Now, Jash asks, are there many common chiropractic adjustments that you use across most of your patients? Well, like many chiropractors, like most chiropractors, I have techniques that I find have been effective, and that's what I use mostly. There's a technique called the Gonstead technique. Dr. Gonstead was one of the giants in the profession. He practiced from sometime in the 20s into the early 70s. So he had a practice in Mount Horeb, Wisconsin, where there's only 1,500 people in that town. And he would see well over 100 patients a day in his clinic. And eventually he built a clinic in 1965 that cost $1 million for the clinic in 1965 dollars, which I don't know how much that is now, probably more like $20 million, based on the adjustments he did. I mean, it was an amazing place. I've been there. That's where I learned the technique. I learned the technique from his proteges, who were young men when they started with him. And there were 23 rooms, treatment rooms. There was his waiting room seated 115 people. It had benches all around the walls. It had a fountain in the middle. Still does. There's still, we donated. Chiropractors who are involved with that technique have make donations to help maintain that huge facility, because it was built by a very interesting architect who was a protege of Frank Lloyd Wright. Now, Frank Lloyd Wright was not a big proponent of having his buildings last very long, and this protege of his used some experimental materials, so there was a lot of trouble keeping that going. And also, there was an 80-room hotel that was attached to the office. He had people flying in from all over the world. So his technique is a great technique, and I use it mostly in my practice with most of my patients. Especially his neck technique is particularly good. So yes, there are techniques. The Gonstead technique is the one I use mostly, but there are other techniques that I mix in with it. So most people, what we try to do on everybody actually, is find the area that's not functioning properly, get it to move, not just make a lot of noise and popping sounds come out of the spine. The popping sound, by the way, is just the joint, the pressure in the joints. If you ever had two pieces of glass that were, then they were wet, and they stuck them together, they're really hard to separate. And the joints, where they come together, they're compressed by the ligaments and the muscles around them. And the two joint surfaces, which are very smooth, they're lined with cartilage. There's, around the joint capsule, there is something called synovial fluid, which is for lubrication. So that creates this film between them, and it's pressed very tightly. They're pressed very tightly in that film. And when you do a quick adjustment, although there's very little force used, the joints separate so quickly. And by separate, we're talking about probably a millimeter at most, but they move, and that makes a popping sound. So you could crack your knuckles, you can crack your knees and your knuckles and your wrists and your Okay, so I'm going to go back, and I'm going to not go from the beginning again. I'm going to go from that point. So we talked about Dr. Gonstead, we talked about the knees, the wrists. So you can make popping sounds come out of all the joints in your body by cracking your knuckles, by moving your ankles, and they don't mean anything, but you have to find the actual joint that's not functioning properly and get it to move so that this area moves more like this area in here. And once you get that moving, then you've done the patient a great service. And so, okay. So the object of any technique really is to get joints that aren't functioning properly to function properly. You get them, and the function of joints is mobility. So you got to get them to move. It doesn't do you any good to move it from point A to point B, because point A and point B change all the time depending on how you're moving. So it's important for those joints to move. So there's different techniques that tend to stress different aspects of normal biomechanical function, but the bottom line is you have to get areas that aren't functioning properly to function normally. And once you have the spine functioning normally, the body is much more likely to function normally. Oh, that's going to be interesting. This is going to be interesting to edit.